Hi there, Dr. Precious, and welcome to our conversation. How are you?
Thank you so much, Prof. Emerecia. I'm doing great. As you can see, I'm okay.
Yes, I can see you are smiling, and it looks like you are really, it's going well with you there.
Yes, everything is going so well with me. Everything is
That's,
fine.
yeah, that's so good to hear. So
Yeah.
tell us a bit more about the work that you are doing there and where you are working and what's happening.
Okay, to start with, my name is Precious Chukwuere. I am here in Florida. I'm a postdoctoral fellow at the Christine Lynn College of Nursing, Florida Atlantic University. So basically, it's a caring science focused college. So the College of Nursing primarily focused on caring science. So, as a present scholar that I am, I focused on my presence. So, so basically, I'm doing a whole lot of things on presence. But the one that is currently going now is with with undergraduate nursing students. I want to understand how they embody presence. It's titled presence, or sorry, it's titled caring in transition. So the essence is understand how the final year nursing students, those in fourth year, uh, embody presence in clinical settings because it's that stage is a transition stage. After that period, the next thing is for them to get their NCLEX done and then get into the field to practice as professional nurses. So I try to understand how these undergraduate nurses embody presence in clinical settings. What does presence mean to them? As a caring college we are, what does presence mean to them, their understanding of presence, how they embody presence, um, even in the light of stress that goes on in the clinical settings, shuttling between clinical setting and then academic activities. So how do they, in all these things, how do they embody presence? So that's basically what we are doing now. Okay, that's basically what I'm doing now, though I have a team I'm working with. So that is it.
Wow, that sounds very interesting. And I'm wondering,
Yes.
what findings have you already seen and how do those students see presence?
Actually, being a caring college, it's obvious that they understand the concept presence. Although some do interpret it from different perspective. As a caring college, the students are exposed to different theories centered on caring science, such as unitary caring science theory and rest of them. So they interpret, some of them, not really all, interpret presence from the angle of compassion, being compassionate, being there with and for your patient. And some of them do make reference to what that's what we call the 5 C's of caring, um, by Rausch. So where you have compassion, competence, and rest of them. So some of them say interpret presence as being there for your patients, even when things are not going that smooth. You are there for your patients. You give attention to your patients. You try as much as possible to uh, connect and attune care to the needs of your patient. But one of the things I found out that the student complain of trying to juggle between the activities that goes on within the clinical settings and then being present with their patient. But even in that aspect, some also made me to understand that those little minutes you spent with your patients, the way you approach things at that moment matters a lot to them. And it has been so interesting
Yeah, it sounds very interesting. And it's interesting to me that they are specifically pointing out the adjustment between the academic context and working with patients. And
Exactly.
yeah, so I so agree with you that it's those small moments that makes a difference and that you don't need to do much, but it's just how you
Yes.
are.
Yeah. That is a place I believe that should have more emphasis, because we all know that the clinical setting is so packed with a whole lot of activities. A whole lot of nurses sometimes don't even have time for themselves, but they are expected to give all to the patient they are caring for. Now, having those little moments, that understanding that those little moments means a lot to the patient. And I also got to understand that even in as student nurses that they are, you find out that some of them really interpreted what happened at that moment on how they feel. Well, you hear that those moments makes me to feel good. I
Mm,
then try to ask, why do you think you felt good at that moment? I said, because I was able to go extra mile. I was able to put a smile. I was able to put a smile on that patient, and also the feedback from that patient at that moment makes a lot to me.
mm.
So it's quite interesting.
And that's so powerful is to see that the moment of presence also means a lot to the care provider, not only to the
Yes,
patient. Yes.
exactly. Because sometimes we tend to overlook the care providers, how they feel or what they get in return. But so it's quite interesting to see that even the care provider also that benefit in one way or the other from embodying presence.
No, definitely. No, no,
Yeah.
that sounds like wonderful work. And you also are still busy with the dream guideline.
Yes. I think I told you about that dream guideline. I have come to embrace dream guideline, and it is what it is. I have that in my mind always. Okay, last time I presented the dream guideline to I think nursing students, 40-year nursing students in Columbia. So I was invited by one of my friends who is a lecturer there in Columbia, and it was awesome. The response, although it was translated because it's not an English speaking school. I don't know about the country, but they had a translator at that moment. So, but at the end of the day, the students were able to ask questions, and then after the whole conversation, the email I got from the school, from my friend through which represented, according to her, the school management, it was so fulfilling. So that shows the impact of presence,
Mm,
the dream guideline. Yeah. So and it's something that I cherish so much. I cherish so much. So I okay, like now we have a manuscript under peer review, and then I also I'm also developing other courses for that. Other research project on the dream guideline, because I believe it's something that should be out there, that the nurses academia should get to know more about, and for that to spread, it is our responsibility as scholars to do that. So, and I'm committed to spread the good news on
oh,
the drink guideline.
that's excellent. And thank you so much for spreading the word on the dream guideline. If I think back on where it comes from here in South Africa, in a small town, we ask nurses what do they see as presence and how do they practice presence. And from there, the dream guideline was born. We also still use it in our presence workshops where the participants think about their dedication and relationship and environment, attitude and motivation. And yes, I so agree with you that we have a responsibility to spreading the word on the dream guideline.
Yes, we do.
Yes. No, excellent. Yes, so it seems to me that you're developing in a strong presence scholar there in Florida and that you're making a difference there and that also you're spreading the word on presence in that international context.
Yes, yes, I do. And next year, I think June or so, I'm a member of the International Association for Human Caring. So last some months back at the University of Rhode Island, we had a conference, that's an international conference which saw a lot of people from all over the world. So next year we'll be in Norway, and I plan to present a paper on presence during the conference. So it is something. Look at what happened. I read the dissertation of Carol Kostovic. I think you have cited her work. I think so. So she is a faculty member in one of the schools here. So I wrote her an email to appreciate what she's doing on presence. So she responded, and it was so fulfilling getting the email back from her, the feedback from her. She responded, and she was like, "Wow, I'm glad to hear that somebody is doing something on presence that she felt like it will go into extinct." I said no, because it is something. And now that we have the advancement in technology, find out that technology, to some extent, is taking away that human connectedness from patient care. So it becomes more imperative for us um, to keep emphasizing on presence. So that is it.
No, no, definitely. I so agree with you. And yes, that's excellent that you're reaching out and building networks that side, and also reminding me that it's so important to build networks and continue to do that. And all the best with your paper next year. It sounds wonderful.
Thank you so much. Yes,
Yeah.
I think it's also very important, as you really pointed out, for us to network, and that's why I have uh, the team in Northwest University at heart, and I I'm glad that even of this month, within this month, I've been off from Northwest University. I still have that contact with the team, and I believe that we have a whole lot of things to work out on presence.
Mm.
And I've been seeing a whole lot of things the team is doing in spreading the workshop to other healthcare facilities there in South Africa, and that is quite commendable.
Oh,
Thank you for your leadership. It's really
oh,
awesome.
thank you so much. I appreciate
Uh,
that kind words, and also to say that we miss you in the presence workshops. We
I wish you
always,
best too.
yeah, yeah, we
Yeah.
always remember you when we are busy with the workshops. Yeah. Any last words, Dr. Precious, to the people listening and watching?
Um, okay. I think to the nurses out there is very important, because you find out that we researchers, we do our part, but now translating what we have done into practice becomes an issue. To nurses out there who, in one way or the other, will come across our video, I encourage you all to always prioritize the patients, in as much as you are also taking care of yourself. You can't leave yourself. There's a part of presence that I'm beginning to like. You have to be present for yourself for you to be present for someone else. So you should continue prioritizing your patients, being present. Do not neglect those little moments, those little activities. The impact it the impact on the patients is always enormous. You might not necessarily see it. The patient might not necessarily verbalize it, but trust me, it goes a long way in helping the patient in one way or the other. And while doing that, always take good care of yourself. While we continue promoting presence in our little space. Thank you.
Thank you so very much, Dr. Precious. Those are such kind words and encouraging words and wise words. We appreciate it so much.
I'm honored. I always remember how I got to know about caring presence, and it was through your student. And then from there, I got connected with you, and the rest is, as they said, is history. So I don't fail to appreciate your good works on caring presence. Prof. Emeretia, you are a great leader. Keep doing the great work you are doing on caring presence. I appreciate that.
Thank you so
If, even
much.
if even if others don't appreciate that, know that I am a product of what you are doing, and I
Oh,
appreciate you.
thank you so very
And
much.
I also appreciate the great time, the great opportunity you gave me while in South Africa.
Oh,
You're a
you're
true mentor.
welcome. You're so welcome. Thank you for your thank
Yeah,
you.
yeah.
Yeah. Okay, Precious, you must have a good time there in Florida and many blessings there. And please also send our regards to your colleagues and the students. We send
Mm.
greetings from South Africa.
Thank you so much. I appreciate it.
Thank you.